Have you noticed in this fall season that you wake up in the morning and your joints are more tight and stiff, you're sore, achy, more so? There's a reason for that. My name is Dr. Augustine. Today we're going to talk about scar tissue. Why does this occur? When you have weather changes outside, there's a change in the barometric pressure. In the scar tissue, you have baroreceptors, pressure receptors literally in this new scar tissue that you have in certain joints, knees, back, neck, elbows, wrists, that can sense a change in the barometric pressure, which is why people will notice, gosh, you maybe have heard this, my back, boy, I can tell it's gonna rain, my hip hurts or my back hurts or something of that sort, my knee hurts. It's actually true. So what is scar tissue? Scar tissue is first and foremost inflammation from some sort of injury, repetitive injury, back injury, knee injury, something of that sort. Inflammation then turns into and heals as scar tissue. And if you leave it that way long enough, scar tissue eventually can calcify and turn into bone, which doctors can take x-rays and say, wow, you got a lot of arthritis. That's because of long-term scar tissue. Scar tissue, when it forms, like I said, you're going to form new pain nerve fibers and baroreceptors in that tissue, which will then help you to sense when the barometer is going to shift. Have cold weather, you're going to feel it in your joints. I'm going to bring Nathan in. We're going to talk about, so what do you do about scar tissue? How can you feel better if you have scar tissue? So Nathan's going to be my patient. I want to say guinea pig, that's not a good thing. So we're going to show, first we're going to talk about what's going to be good for Nathan's back, his spine, his lower back. Say he has chronic lower back pain. So first and foremost, I'm going to have you bring your knees up, and I'm going to go behind you here. Cool. So what you want to do, Nathan, is grab your knees, and you want to really move them quickly up towards your chest, and you want to have you lift your pelvis kind of up in the air a little bit. Yeah, just like that. Just like that. Cool. And in so doing, you might feel a little bit of soreness initially when you do this. It's not bad. It's because you have scar tissue in your lower back. So if he does this 10 times or so, that'd be great. So that's a start with your lower back. Then I would put your feet flat, keep your knees bent, and what you want to do is flop your knees side to side. So just go this way, and then come back. And same thing, maybe 10 times to each side. And then do this before you get out of bed in the morning. When you go to get up, it'll feel so much better. Now, what if it's scar tissue in your knees? And so many people who were athletes back in the day, they'll probably have some knee pain and knee soreness and achiness and stiffness. So one great thing, if you can do this, is to literally squat down like a catcher's position. So once you're there, you want to kind of bounce up and down a little bit. You might hear a pop like my knee just did. My other knee did.
Nice.
And that will help to move those joints to the point where you can break up some scar tissue. Yeah, come on back up. Mm-hmm. If you can't do that, you might want to do that same position when Nathan was right here. You can grab one knee and pull it up and do it that way. Try to do it that way. That'll help too. So what if it's your shoulder? First and foremost, you want to maybe face the wall. If you can't really raise your arm up very quickly, you can wall walk. You can put your wrist there and just walk it up like this.
Okay.
Okay? You want to go all the way up, and once you get your elbow straight, you want to lean in there. Lean forward. It's really going to stretch out that shoulder well. Mm-hmm. Good. Now back off a little bit, and you want to turn your whole body to the right, towards this way. Even further. There's your whole body, feet and everything. Oh. There you go. Now lean in. There you go. That's great. Now another thing you do is reach down, same position, reach down and touch your back, and actually push that elbow against the wall. So turn your whole body again further. There you go. Yeah, push that. There you go. That's a good stretch for your shoulder. And then you can also turn it underneath here, turn a little bit further, and you can push that elbow this way. You can actually, if you can grab like you could do that too. You could pull it that way.
Okay.
Yeah. You could also put this on like a doorway. You could grab a doorway here, and as you step, just lean that way, it'll pull your shoulder.
Oh, yeah.
Yeah.
Yep. Cool.
Great for shoulders. Hands and wrists. Flexion and extension. So I would literally push your wrist down this way. Okay, push it down, pull it back, and then also you could do circles out this way, and you could do circles inward this way. Some people, lots of people have arthritis and scar tissue both in their wrists. Some people actually have those cysts, a ganglion cyst as well. This will help to break up that scar tissue. So if you can keep your joints warm and keep your joints moving during the cold weather, it will help dramatically. So moist heat's best. Take someone who's arthritic and full of scar tissue, hot bath, hot shower, jacuzzi, excellent. You will feel so much better. If you can only get a hot shower, that's still better than not. People say, well, I don't have a jacuzzi. That's okay. Hot shower work really well. So thanks for the help, Nathan. Now we're going to talk more about, let's talk about chronic issues. If you have this chronic persistent lower back problem, what should you do? First and foremost, you should get to a chiropractor that first will take x-rays. You need to take x-rays to know how to move the right bones the right direction. Secondly, the problem typically won't stay in position, so you would need to do some corrective care. I have some videos, corrective spinal care video, where I talk about more of the board specialty that I've done to be able to get corrective changes in the spine. It's called ASBE. We can fix spinal issues because the missing link to fixing a spinal problem versus just giving somebody temporary relief is musculature. There's a very special set of deep postural muscles that need to be re-strengthened so that we can get your spine to stay in position and move normally in all directions. So reference that. It's on my YouTube channel. Let's talk about nutrition now. Let's talk about a few nutrients that I would recommend that would be very beneficial. The raw materials to repair joint tissue, Ligaplex 1 and Ligaplex 2. Ligaplex 2 is more for tendon muscle issues. Ligaplex 1 is more cartilage and deep joint tissue. Also turmeric. You can find all sorts of turmeric all over the place, Costco even. The problem is turmeric's carrier medium that carries turmeric around your body classically is black pepper. Black pepper is not very effective. The one that I really recommend is called turmeric forte, and it's bound to fenugreek. It's an herb that actually can take it past the blood-brain barrier to deal with inflammation in the brain. So amazing product. I will leave a link in the description below for these nutrients. So from a dietary perspective, the ketogenic diet is the best because it's very anti-inflammatory versus our standard American diet, the SAD diet, which is mostly carbohydrates, starch and sugar, very pro-inflammation. So ketogenic, higher good fats, lots of good fats, proteins and vegetables, whereas standard American diet, as you know, lots of starch and sugar, not so good. That would be the best way to eat to be very anti-inflammatory to help your joints out tremendously. So in summary, if you notice that during the holiday season, the colder winter months, that you start to have more joint pain, stiffness, pain, soreness, tenderness, that sort of thing, then most likely it's going to be scar tissue. If you have chronic issues that don't go away, because we just showed you some exercises, I would say first and foremost, try these exercises that I just showed you. If those don't help and you have more chronic issues, definitely notify me, connect with me. You can email me at draugustine@gmail.com. You can call my office at 562-860-3404 and schedule a free discovery consultation to see if we can help you. If you like this content and you enjoyed this video, please like and subscribe to my channel. I'm on YouTube, Facebook, Instagram, and TikTok. My name is Dr. Augustine. Have a great day.